Bienvenue à toutes et tous. Nous aurons de la traduction simultanée aujourd'hui. Je vais d'abord donner les instructions de traduction en anglais et ensuite revenir en français avec les mêmes instructions. So, hello everyone, welcome to this webinar. Sorry about the glitch earlier. Because we will have simultaneous translation today, I will start by providing instructions in both languages to make sure everybody is properly set up. So, the webinar will be led in English with presentations in English and in French. The slides in both languages can be downloaded. There's a link in the chat box, and simultaneous translation is available. To access the translation, you need to click on the globe icon at the bottom of your screen, and then click on the language that you would like to hear. So I will now provide translation information in French. Rebonjour, le webinaire sera animé en anglais et on aura une présentation en anglais et une autre en français. Vous pouvez télécharger les présentations dans les deux langues. Il y a un lien dans la boîte de discussion pour ça. Et la traduction simultanée sera disponible tout au long. Pour y accéder, vous trouverez une icône de globe au bas de votre écran. Cliquez dessus et ensuite vous pourrez choisir la langue de votre choix. So, now that everybody is settled with simultaneous translation, I want to properly welcome everyone to this webinar organized by the NCCHPP, the HARMONICS research team in collaboration with the Regional County Municipality des Maskoutains. My name is Florence Morestin. I'm a scientific advisor at the NCCHPP and its acting coordinator. Today, we have the opportunity to learn about health promoting intersectoral collaborations at the local level based on examples from Ontario and Québec. Before introducing our first speaker, a bit of housekeeping. So please use the Q&A box to ask questions of speakers. You can type in your questions as they come up during the webinar in the language of your choice, and we will have a 15-minute Q&A period at the end. The chat box is for letting us know if you experience technical problems or to share your comments with everyone. This webinar is presented by the National Collaborating Center for Healthy Public Policy, or NCCHPP. Our mandate is to support public health actors in their efforts to develop and promote healthy public policies. If you would like to learn more, there's a description of our organization in the chat box. We are based in Montreal, so I would like to thank the Kanien'kehá:ka Nation for their hospitality on this unceded territory. And all that being said, I would like now to invite our first speaker, Dr. Ketan Shankardas, to open his camera. Dr. Shankardas is an associate professor at the Department of Health Sciences at Wilfrid Laurier University, where he leads the Health Equity Systems Interventions Lab. He also leads the HARMONICS research team, which he's going to tell us more about. So over to you, Ketan.
Thank you, Florence, and welcome to all the participants today. And before I go any further, I'd like to acknowledge joining you from Waterloo, Ontario today, which is land traditionally used by the Haudenosaunee, Anishinaabe, and Chinantan people. Today we're going to I'm going to tell you a little bit about a current research study which has involved collaboration with 5 local level cases where intersectoral action is being used in a sustained way to address equity. And these 5 cases take place in 2 Canadian provinces, Ontario and Quebec. As I tell you about these cases, I'm going to try and give you a sense of how this research project was partnered in a unique way with knowledge users and with knowledge mobilizers. And in turn, it was more of an applied research project. And so I want to give you a sense of what that looked like, as well as a flavor of the practical outputs so far to date, which are a series of policy briefs that we have focused on to date. And I'm just going to take control of the slides. Okay, yeah. And so, let's see. Sure, I can do this. Okay, I'm sorry. Things are getting away from me. Hmm. Okay, I think I've got my confusion figured out. Okay, let's get back into it. So today's webinar, it's really just an entry point for this series of 5 policy briefs, which have just been published. And so these briefs are based on research methods, like a research study, but they're plain language documents. And we formulated each brief to focus on the issues that each case partner was interested in learning about. So they're not really traditional research outputs. They each include a very concise description of the context of each case, a little bit about what the HiAP initiative looked like. And then, we talked to about 10 to 14 people in each case who were involved in implementing this work. And so each brief also includes a series of recommendations based on what our interview participants told us about the ups and downs or the strengths and weaknesses of their work. So the briefs are available now. There are English versions and French versions. Currently, we have print versions available online, but web accessible versions are going to be available shortly. And the QR code on the screen for me right now will take you to the English website. And I believe if you are looking at the French version of the slides, that QR code will take you to the French website. So an invitation to please visit and learn about all of our policy briefs. I also want to take a moment to acknowledge the bigger team of people who have been part of developing the methods for and conducting the research that I'm going to talk about. It's a really collaborative project. My co-principal investigator was a medical officer of health in Peterborough at the time of the study, Dr. Rosanna Salvatera. And we had collaboration from folks in each case setting. Sometimes there were other medical officers of health, or they were public health workers, or they even worked for the mayor's office in some cases. And that really helped us to coordinate a more collaborative project. We also had support from a number of trainees. Now, before we get into research about health and all policies, I feel like providing some context because not everyone in our audience will be familiar with health and all policies. Indeed, some of our audience are not even from public health. So as a starting point, you might have heard about the social determinants of health. And the inner layers of this framework you're looking at describe how our health and well-being, or for that matter, our quality of life, are shaped by many factors that comprise our daily living and working conditions. That's the environments and experiences we have over our lifetime are going to be in relation to our employment, our access to housing, our food, education, income, neighborhood safety. The list could go on and on. But what I think is really important here, and those are those living and working conditions, but let's draw your attention now to the outer ring, because those social determinants of health are distributed within a society by what are referred to as the structural determinants of health or the social determinants of health equity. And so governance is one such structural factor because, of course, if you have a government that focuses its impact on population health by planning and managing a healthcare system, and that's their primary focus, is we're going to make our society healthier through healthcare. And they don't really recognize how maybe a poverty reduction strategy could be a way to reduce wait times because most of the high volume healthcare users are poor, right? If that kind of a connection is not being made by a government, then the social determinants are more likely to end up being distributed unfairly across a society. So governance matters. For the last 20 odd years, I would say that most healthcare systems have been slowly creeping towards this lack of sustainability, where we have an ever aging population, ever growing demand for novel medical technology, And say in my province of Ontario, I haven't seen us putting enough effort into prevention. When I say effort, I don't mean people on the ground working in public health. When I say effort, I mean money. We haven't been investing in keeping us healthy in a public health system. And so a 2016 report from the Public Health Agency of Canada stated that socioeconomic inequalities in health are costing us at least 6.2 billion annually in acute care hospitalizations, prescription medications, and physician visits that could have been avoided. So we do need to do a better job of prevention, and we can do that by improving our governance of the social determinants of health. And that's the really simple idea behind the health in all policies concept. Here, as described by the World Health Organization, as an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies, and avoids harmful health impacts to improve population health and equity. Now, that definition is pretty conceptual. And to be clear, HiAP is not a really formalized model of governance that you can just pick up and apply in your jurisdiction. For example, some impact assessment tools literally come with a manual that you can follow to apply in your organization. But, as the HiAP definition from the World Health Organization suggests, HiAP's a concept. It makes a lot of sense. It's going to help us engage with the social determinants of health better. But how a given government might implement this approach is very, very unique. And it's very creative, and it happens, as a one of one, I would say, in every instance. In fact, this idea, sorry, my office has automatic lights, which I did not anticipate, and I'm going to see if I can trigger them. Anyway, you're not going to focus on me anyway for now. Where was I? Yeah, so of course, every government ends up taking this concept and applying it in a unique way. As you're going to learn soon, many of the cases out there where there is intersectoral action being used to improve population well-being and equity are not even focused on health, are not even referring to themselves as health in all policies. Those folks might not even know about this concept, right? As a research team, we are taking some initiatives out there and saying, oh, yeah, they're doing something that looks like this concept of health in all policies. And so rather than I just have this more conceptual approach to what is health in all policies. And for a case to be health in all policies, we want to see that there's intersectoral action happening, focused on improving health and well-being and equity, and that is durable. So it's not just a one-time short little initiative. It's meant to be something that's going to continue in the long term, and it's going to be as systematic as possible in addressing those social determinants of health. You might like to see in a health and all policies coordination, not just within a government level and in all the different sectors and departments and people outside of government at that level, but also because of the fact that many social determinants of health are planned and managed by different levels of government. You would also want to see some coordination across government levels. You want to see a focus on improving population health and equity beyond the healthcare sector. So this is not just about making healthcare systems more accessible and equitable. And finally, you want to see evidence-informed policymaking in a health and all policies initiative. And I'm just giving you this quick example of a really great student I had a few years ago who decided to open up the sausage-making process of policymaking when it came to a really unfortunate decision of the Canadian government in 2012 to make cuts to refugee health coverage. And he kind of did freedom of information requests, and he discovered that that decision was not based on evidence at all. It was a very political decision. And I'm really just highlighting this to highlight this idea that health in all policies is meant to follow the evidence. It's not meant to be kind of a political project. Now, why would we focus on learning about health in all policies at the local level? Well, local governments are uniquely positioned to influence certain social determinants of health, planning related to transport, health promotion, land use, building standards. Lots of other things, physical activity promotion, for example. Local governments also tend to be more in tune with the needs of local governments. And so they can arguably try to plan and manage better access to social determinants of health in a way that's more meaningful to local communities. Um, HiAP at the local level is not so much of an internal activity where they're just focusing on getting government actors to play well together. At the local level, HiAP tends to be more engaged with the third sector, community organizations, the private sector, so like the Chamber of Commerce. And so HiAPs at this level can take advantage of those kind of realities on the ground and bring in collaboration from outside of government. I have First Nations here, and I don't want to suggest that HiAP is going to be a panacea for reconciliation. That might require more of a focus on Indigenous rights in all policies, for example. But there are some examples of Indigenous governments engaging in these types of local initiatives. I'll tell you about one later, or tell you about some later, but for example, Vancouver's Healthy City for All strategy has a mandate where the city manager's office, the regional health authority, and the Equal Employment Opportunity Office are mandated to offer opportunities to their workers to improve their capacity and their competency to work effectively with First Nations and urban Aboriginal communities. So it's a starting point, but it just shows you that this kind of work can be a bridge to better engaging with our First Peoples. And finally, there are some examples of kind of local governments influencing what provincial governments and territorial governments think and do. And so that's another reason to kind of foster more of this kind of grassroots level, or at least local level action that looks like HiAP, because at the end of the day, we really need all of our levels of government to be thinking like this. Okay, there isn't so much research about HiAP at the local level. Uh, Certainly there's a little bit, but one of our team members, Maria Guglielmin, in 2018 did a scoping review about the implementation of HiAP at the local level, and she ended up finding examples of HiAP happening at a local level in all of these countries around the world. And of course, you see the Scandinavian countries that you would expect, but it's not just them. And so you can see some other surprises in there. And, on the other hand, it's not really as widespread as we might kind of hope and expect at this point. So today we're going to focus on these 5 case studies, and they are located in Ontario and Quebec as shown on this map. And maybe one thing I'll highlight here is that 4 out of the 5 cases are really examples of regional governments where there's a city surrounded by townships. And so it's more of a collection of governments doing this kind of initiative. The 5th case, Sherbrooke, is a city level example. I'll be telling you more about each case shortly, but for now, you can just soak in the pretty logos and the titles of the initiatives. And I'll tell you a little bit about, another level of this work, which is that, 2 of the cases are in Quebec, 3 are in Ontario. And in Quebec, the provincial government has been using a HiAP approach since the revision of their Public Health Act about 20 years ago. And they've continued with other initiatives that kind of build on that kind of work at the provincial level. And so, in Ontario, on the other hand, we haven't had that kind of action towards HiAP at the provincial level. And, the culture of thinking of, health and social outcomes as intertwined, and we need to plan and manage those systems in an integrated way hasn't really been dominant in Ontario in my experience. So there was stuff to learn about what was happening at the level of each case, but then we were also thinking about, what's the role of those provincial governments as well? I won't spend much time here, just to highlight that across the top, that's kind of a traditional research project plan. But we were really focused on knowledge mobilization, and we had some great collaboration from the NCCHPP from the beginning, really. Carolyn Tessier from their team did a scientific review of policy briefs so that we could be really well informed about how to produce these for our collaborators. And the NCCHPP has also been closely involved in helping us write and finalize these policy briefs. And we are now at the point of, well, we've kind of conducted some workshops where some of our partners wanted them, and we're on the point now of shifting towards maybe some cross-case analysis. And of course, COVID happened in the middle. So this was not a 4-year project. We're just kind of right now, we're kind of where at the beginning of year 4 of the study, but we started about 5 to 6 years ago. Another slide that I won't spend much time on. This is a busy figure. All I want you to take away from this is that we approached each case study with an acknowledgement that there were program activities, governance structures, other factors of interest that would have made each case very unique, both in terms of what was going on before they started using a HiAP approach and after. And that our goal was really to learn about those boxes in the middle of the diagram, the mechanisms that those kind of realities on the ground triggered that either spurred on implementation or got in the way of it. And so if you want to read more about our conceptual approach to this work, you can see this paper in the reference list at the end of the deck. Okay, now, in terms of research questions, we were in this interactive relationship early in the project with our partners in each case setting. And so we developed the foci for the interview guides and for each individual policy brief in conversation with those knowledge users. And we were interested, we decided collectively we would be interested in, what does that local mandate look like for intersectoral action, and what should it look like to really facilitate collaboration? What are some things to avoid there? We were curious about leadership. What's the role of leaders who are going to be trying to bring people together for this work? As I mentioned before, what's the role of the provincial governments? And what about conflict between the different partners around the table? How do you deal with conflict? How do you navigate conflict? We were also interested in separating out recommendations focused on earlier in the process of doing this kind of work from recommendations that might be relevant later. Once you've kind of got a more mature initiative going, what can help you at that stage? And then finally, so we worked together to really make sure that the policy briefs would be useful to each of the case settings as a one-of-one. And we offered to also have workshops in each case setting so that we could try to mobilize the knowledge more effectively. Our case studies involved talking to people on a variety who were working on a wide variety of policy issues and coming from a range of institutions like academia, from the community or not-for-profit sector, the for-profit sector. And so just to highlight again that whereas at the national level, HiAP is often, but not always, more internal facing, about ministries playing well together. At the local level, it really does involve a wide range of organizations, including outside of government. Okay, I'm going to tell you a little bit about each case. So in Chatham, Kent, they set up a community leaders cabinet. And you can see in the map there, Chatham is that kind of gray blob in the middle of the area, and that's the city of Chatham, and it's surrounded by rural townships. And they put together a steering committee who wanted to work together to build a community where quality of life is planned, developed, and championed. So note that they weren't focused on health. They realized that quality of life is what links everyone who's around the table here. Everyone's interested in improving quality of life. And so they had leaders from local organizations outside of government, leaders from government, leaders from the business sector, from nonprofits. So the United Way, the Junctura Group was a big property developer, very influential in the community. The school board was there. In Peterborough, we looked at Sustainable Peterborough, which had been going on for even before 2012 as a community grassroots initiative of organizations interested in sustainability. But in 2012, they formalized into Sustainable Peterborough, and they developed an action plan focused on becoming caring communities that would balance prosperity, well-being, and nature. So you can see again how the focus is rarely just on health or on health at all, but it's on health adjacent issues always, I would say. And they had action areas specified that were relevant to sustainability and these sub-objectives like agriculture and local food and cultural assets. And their collaborations included city governments, representatives from the county townships surrounding the city of Peterborough, nonprofits, the private sector, public health, First Nations. So a really diverse group of collaborators. Elgin St. Thomas, which neighbors Chatham, Kent, and is another one of these settings where you've got a city, the city of St. Thomas, which is the gray blob in the middle, surrounded by rural townships. And they had a steering committee of community leaders, and they were interested in improving quality of life for all residents. And they envisioned their role as endorsing actions as leaders, lobbying elected officials, using their power, supporting different initiatives through their organization's work, and helping to implement them, and raising awareness about the importance of certain challenges to quality of life. And they had community leaders around the table from, again, a wide range of governmental and non-governmental organizations, including First Nations, policing, public health. And finally, or not finally, from Quebec, we've got in Les Maskoutains, and you're going to hear more about this case shortly in depth from our next presenter. But they were kind of challenged in 2017 with merging family policy and social development policy and bringing it under one umbrella. And they saw this as an opportunity to really improve quality of life for everyone, because the issues that, family policy folks were dealing with were very closely overlapping with social development policy. And they kind of had an interesting collaboration structure. They had two kind of groups working in parallel. One was the Social Development Committee, which was really doing most of the day-to-day work involving the collaborators from different organizations. And then they also had an oversight committee that was just kind of keeping track of the work and the outcomes over time. And finally, in Sherbrooke, Sherbrooke has been a WHO Healthy Cities member since 1987. And the Healthy Cities are very kind of similar to the idea of health in all policies. And they've been doing this for decades. And so we saw them as a mature example of this kind of intersectoral collaboration focused on health and equity. And what we decided to focus on was a new kind of initiative of theirs, so that we could see how this work happens in a more mature environment of collaboration. And so in 2016, they decided that they needed to address alcohol-related harm among youth in the community. And so they brought together, post-secondary administrators, health professionals, doctors from the ER who were seeing people coming in from these post-secondary institutions with alcohol-related harm, and an array of other kind of partners to try to tackle this issue in an intersectoral way. And what I'm going to do now is just kind of close out with some of our recommendations. So, I hope you can have some time to look at the 5 policy briefs, and I'm just going to give you a flavor of 2 recommendations that for me kind of emerge when I read all 5 of them again recently. First of all, one of the recommendations, and this was kind of present in all of our cases, HiAP members want to have an impact in the community. And so the recommendation is really to try to find ways to structure that in, that kind of action orientation. So we heard from people across all the case settings that when say the mandate was framed in a way that was action oriented, or the meetings were structured in a way that facilitated action, that was very motivating for them. That made them want to keep coming back to future meetings. They were there to, they were willing to step out of their daily environments if they could have a bigger impact, in other words. And so you have to make sure you're giving them that opportunity. One way that some cases did that was early on, just showing members what kind of an impact they could have by using examples from other settings and showing them the types of things that they could end up doing. And another thing that we learned that some cases did is they intentionally structured in some easy wins initially. They said, let's see if we can get together and we'll apply for this grant and we'll tackle this one issue. And then they do that within 12 months, and it shows the committee that we are action oriented and we can do this. And it was very motivating. So definitely try to have an action focus if you're going to use HiAP. The second recommendation that I'll kind of leave you with, there's 2 slides here, but the recommendation is to let HiAP members talk to each other. And that might sound a little funny, but let me explain. So definitely find time intentionally with your meetings to structure an open communication and discussion. It doesn't have to be overly planned and managed, those meetings. There doesn't have to be a really detailed agenda. Why? Well, there's 2 reasons. And the first reason is that open discussion helps members collaborate better. And that's what you've brought them together for, is to collaborate. Now, how does that open discussion help? Well, it allowed people around the table to identify shared goals and needs. So just kind of as a baseline, what are we all interested in? What do we do in our day-to-day? Oh, okay, there are some things that we have in common. And so establishing a bit of common ground with your community of actors there can be one of the great results there. It also helped these initiatives generate a shared vision of how we were going to do this. How are we going to make an impact together? How could we possibly do this, right? There's no easy answers initially, but open discussion lets everyone kind of come to this discussion on their own terms, and you can co-create this is what we're going to do together. It also improves an understanding of each other. So, and of each other's issues. And so, what we found is that led to better problem solving. So, from one organization's perspective, the issue of, say, youth alcohol use and abuse might look like this. And from another organization's, it looks like that. And when you start to talk to each other, you get a more holistic understanding of the issue. And so you can better tackle it. And finally, open discussion just helped members get to know each other and be more friendly and trust each other. And all of that stuff is really important for, an authentic collaboration. And the second reason that you want to let HiAP members talk to each other in meetings in an open way is because, you know what? Those folks are there for their own interests as well. They're showing up to these meetings, yes, to be a part of a collaboration and make their communities better, but at the end of the day, they're self-interested. And what we found is members told us that, yeah, they really loved those open discussions because they learned more about the community that they are serving. And so they could take that back to their organizations. They also identified different people around the table and organizations that they could be working with outside of the HiAP initiative. Oh, I didn't know that, people over there are doing that. We should maybe have a conversation with them because we're thinking of doing that. And finally, by kind of getting all of this kind of intel about the community and building new partnerships outside of the HiAP, those organizations were achieving their own long-term goals as they participated in the collaboration. And so, yeah, kind of 2 reasons why you want to try and structure in more open discussion when you do HiAP. I have gone a little bit over time, apologies there. And we've really just scratched the surface of what types of evidence and recommendations these policy briefs contain. And that's by design because we want you to visit the website and download the policy briefs and read about each case. They're not long documents. We've taken a lot of effort to plain language them, so we do hope they'll be useful to you and your teams. And I also want to thank all of our partners in these case settings for agreeing to make these policy briefs public and to allow them to be downloaded so that our project can be useful beyond just our initial collaborations. So thank you for your time. while we transition over to Elise, I'm just going to invite you. We know that about two-thirds of you are already involved in intersectoral collaborations. And if you'd like, you could put in the chat something to tell us about what you are focused on with your collaboration, maybe something about who your partnerships included, the partnerships that were included, just so we can get a sense of the type of work happening out there. And that's in the chat, not the Q&A. Thank you.
Well, thank you for that, Ketan. Thanks a lot. Many people already have asked in the chat box if they could get the links to the policy brief. So I think they'll be happy to get through them. Maybe you can get me to the next slide.
Yep,
Yeah,
those are the
thank you.
reference.
Yeah,
Okay.
perfect. So now begins the French portion of our webinar. So if you need simultaneous translation, please, again, click on the globe icon and put yourself on the English language channel. And also, if you had closed captioning on, I advise you to turn it off because it will not work properly at this point. So I will now switch to French.
So I want to actually invite our second conference speaker here today, Elise Simard, and she's a project manager in the Maskoutains municipality. And since she has been there, she has put into place the first initiative policies for that region, and also for the politics, health and all policies initiatives. She will speak about this a little more on these policies. And I think she's in the midst, or she's preparing herself right now. Do you have the control also for your slides? Yes, I do have. She's coming in a little faint, but we'll manage. I'm just gonna go ahead with that. Perfect. It's your Elise. So thank you, everyone. I just want to assure that everything that has been said in her representation, here it is. Here's the outline. I'll just present you the presentation outline. I'll go quickly. What is an MRC? I'll talk about the RCM, the municipalities, and the profile of territory and population, strategic vision, mandates, responsibilities, and service policies. We'll also talk about the evolution and the history of the family and social development policy and the stakes that are at hand. So what is an RCM? What is a regional committee township? Regional commissioners were created following the adoption. They're they're essential to give the different local on subjects of on things happen. They regroup actually under the same authorities, which form an entity, administrative entity, which has been which is managed by elected committee, and there's also a committee which meets every month. Though here you will see the profile of the territory. Just 1 second, please. You will see the profile of the territory, which is Saint Hyacinthe here, 64% of the center you're seeing here. It's a 1,312 square kilometers, 91,414 inhabitants, denizens, and 64% of it, one on three citizens are living in this territory. Here are some statistics, and the growth from 2021 was 13.3 population growth. Average age was 44.5 in Quebec. The rate of employment was among 25 to 64 years old was 76.6. And in Quebec as a whole was 74.1, 2,200 kilometers of waterways. Now let me show you the population of 2013. It is regrouped, as you see, under 17 municipalities. 2 are cities, Saint Hyacinthe and under 100,000 inhabitants in Quebec, we consider it a municipality. So in 10 municipalities are under 1,000 and 3,000. So we see here the breakdown of the population. Almost Saint Hyacinth is at almost at 60,000, and Saint Pi is at 5,918. Therefore, it has been revised here, a new vision, strategic vision that is from 2023. Four intervening access points are created here, and now it's an inclusive and evolutive living environment. One, that's ally and caretaker of the county's natural environments, population proud of its regional identity, accessible and resilient territory, and dynamic agricultural, economic, and cultural development. These are the four axes. It's made in an integral manner, if you wish, to adapt to the landscape of this type and also the climate change effects, which we are seeing now. The cultural part of it is actually in growth. It has the inaudible, her she came chopped up, I'm sorry. It is also looks at the culture and the economic and cultural development as mentioned from these to ensure, here we have dynamic agriculture, economic and cultural development. To ensure the development of economic activities, preserve agricultural land and farming activities, as well as the agri-food sector. Leverage also cultural to boost development, and ally and caretaker of the county's natural environments. That is to ensure conservation of natural environments and maximize the ecological services it provides. Now we're looking at the mandates and their responsibilities. We has to do with land use planning, property value assessment, water course management, sale of property, municipal taxes for non-payment, fire protection, civil protection, fire prevention, and the Quebec Provincial Police also. We also have services offered to the population. Amongst them, we have support for watershed communities. We have support for an inspection of riparian buffer strips in green zones, a map on the road for cycling lanes, paratransit, regional public transit, engineering, and art soil, if you wish, for cultivating, and which is not always easy, the last part, the art terre she mentions. Now, in what has to do with policies and more precisely for the policies for the family and social development policy. Actually, I'm sorry, I jumped one, and I want to present a biodiversity policy. Before that, I did tell you about the strategic part of it, the mandates, and the services offered to the to the citizens, which are at the basis, the heart of the municipalities. But I cannot forget the biodiversity. These orientations guide regional planning with the aim of ensuring quality living environment for residents, harmonious coexistence of different functions in the territory, for example, agricultural, industrial, residential, while limiting our footprint on the environment in the interest of the community. So it's really the municipality is aware of family and social development, and it works in conjunction to assure that the policies will keep into account the inhabitants and the necessities of the persons living on this territory. Family and social development policy. Therefore, here, let me go to this section here, says the interlocutor. The first part is how the history comes from first policy in 2007. We were not talking about these issues in 2007, but more we were giving out prospectus or brochures to familiarize the citizens of the policies, how the territory is being is under, what type of urban planning it is under. Now, 10 years later, updated in 2017, we went a little further. We had an introduction of social development, health impact assessments, the HIA, if you wish, and to encourage also the partnerships which are favorable and gives an impact on the health and yes, on the health and the development of this. In 2024, there was an update of this, of the participation of the citizens. Now, what happened, there was a transversal type of participation. What does this mean? Once we offer type of services, it is important not to give the food only, but to actually go a little further, look at different type of ways of creating the supply chain, and also looking at our purchases. And also to have power to actually put these into place and institute them in our municipalities. Up to date, we were the first municipality to ask for an HIA, and the report, and the recommendations is part of these updates. And we are now referring to these HIA health impact assessments. We are presently in progress of putting everything up to date in 2024 of the 16 municipalities. And we want to go a little further now. We want to look at the air quality, the water quality, the transport, the heat waves that are coming in, the climate change, all for a better living of our citizens in 2024. And in Saint Hyacinthe is also putting up their their policies for the citizens. Now, a regional age-friendly policy, what is called the MADA here. This is it is movement which is international, and the municipalities were adopted in 2015, first policy, and then updated in 2023. This was the MADA, the MADA. In rural areas also, there was participation. One of the challenges that came up from this MADA family is to plan and to know the projects, the different obstacles, and different financing which is offered through this program. Not forcibly at the moment we are asking for them or when we want them. And sometimes the MRC is asking for a flexibility on this from the stake and all the projects that are put forward in conjunction with the policies. So they're asking for some flexibility with government for the governance through the government. I spoke about the committees established a little before. From the first political family standing committee we put together, this will have, we call it the RQF. This was the first family standing committee to stay on the permanent commission that was put together to represent the municipalities, to represent different sectors, also older people, youth, and one also this committee, excuse me, puts forward recommendations and also follows the different files which are on the table at that point. In 2017, the International Day of Development formed a committee. This was called the Social Development Committee, which was put together, and immigration, employment, business affairs in the area, etc. 17 members sit on this committee, the Social Development Committee, and also give recommendations. This took a little time for this committee to find its footing, but it is important, and it still is important, that they have a different mandate compared to the Family Standing Committee. These modifications were made to its composition of this committee, so this could be acquired, so they could have this different standing compared to the Family Standing Committee. In order to meet and help the citizens also through the municipalities, on different type of transversal type of stakes, proximity, security, and also the information be given out to citizens, and also in the development, social development. Now, the challenges and issues, I want to point out some challenges and issues of the two committees I just mentioned beforehand. First of all, we have to give support. We have to support municipalities in implementing their family and age-friendly policies in action plans. Starting from there, from the municipalities that give regional type of support, they have to elaborate these action plans, and they will have an direct impact on the citizens of this area and their living conditions and their quality of living also daily. This will have a direct impact on their health of the citizens. For example, the infrastructures, the libraries, these are very important and will align and permit the citizens to have meeting areas as required in their daily living. The last few years, many of the municipalities have constructed these meeting points and have also come together with school boards to work in conjunction to have a common goal. For example, gymnasiums, libraries. This type of partnerships is very important because we're serving the same clientele in this type of environment. It's also important to work with everyone because it's them that take the decisions, the community, the persons in the community. And there has to be a decision that is taken that is very clear and very precise. For example, any questions that come up, any type of general questions. And you have to also keep into account the elections. Parties change, councillors change, and we have to keep this into account. An elected individual has to be there to help and respect the budget, also help the citizens. Not always simple. He has to convince the populations that his decisions have a probative value, which is evident to the citizens, and has to be at the heart of many decisions. For example, lodging. In Quebec, there's actually, in many places in Canada, presently there is a lack of housing all over the country, and in Quebec, there's no exception. So, and sometimes neighbors don't want to have certain groups or individuals in their own backyard, she says, and this is an issue. And now we also have to do an evaluation every year with the municipalities. And these committees always have to stay active. Why? Because sometimes the members change, and you have to bring them back to their action plan. You have to also inform the elected officials, inform the citizens also of the municipality. You have to work with the community. You have to consult and be in partnership with the citizens. You have to also do a type of advice for the youth, explain why a certain plan of action did not work, and because that maybe the needs are different. The citizens and the are very important in the municipality, and we cannot overlook it. We also have to look at respecting partners in their fields of expertise. This is also a challenge, but we have to work with different projects which not necessarily align each other at a good time. And this also financing prong, if you wish, is very important. And you have to continue the actions. Sometimes the financing is based on 1, 2, or 3 years, and then it just stops. There's a dead stop, and there's not any other funds to pursue the project in place. You have to work with the environment. The concept of partnership is very important also. And to be also a facilitator of the plan with these partners. Also, you have to be at the heart of many consultation tables to inform the municipality and to inform also the services available. This is a back and forth type of relationship, mentions the interlocutor. And also you have to create common services, partnerships, which are also important. For example, we put into place a project, CERCA, which means the welcoming type of service, and an accompanying type of service under the acronym CERCA, which will permit the citizens to know better their maybe their scolarity type of path they should take, the services available with that school board, the propositions, recommendations that were put forward also. Yes, to have access to a locale if you wish, to meet citizens, and also to publicize the information and the gleanings which are available for the citizens. This is something that doesn't cost much, but is nonetheless very important for the citizens that want to make a change in their daily living lives and ameliorate their type of living conditions for this person who opt for these services. We also have to respect their partners in their fields of expertise. So it's very important not to overlook this, to not do not yield the place to others of other person. You have to respect the mission of each one and their knowledge. For example, we put into place a project against violence against women, and so we went and sought after an experienced person in this bailiwick to put into place the sensitivity part of this section, and we want to represent most of the municipalities, if not all, and have persons in this position that are expertised, and also without to permit these women to maybe to go to these municipalities to have a place where they can launch a call, a telephone call, and see if these services exist for these women in need. Of course, this collaboration is very interesting on our part, and also we're also trying to go a little further down the road. And we are also looking at the women or persons that have taken advantage of these type of services, and to see and to for them not to be afraid to intervene from our part, but to help the person more than intervening. So another committee was put into place with public health safety to look at the stakes of integration. And of course, the particularities of children in camps, day camps, for example, and looking at their integration and looking at their needs. And also respecting the partners. I want to reiterate this point is very important. So also I want to underline the importance of partnership and the public health system, which will answer to our needs and to help us and shoulder us and be side by side. They are priceless in our efforts here, if you wish, of services that may be available in our area for the municipalities, for the quality of life, and also for the landscaping of the parks, the urbanization part, the urban planning, if you wish, and also the agro-foods sector also. All these actions that we want to put into place will permit us to work in a prevention mode, if you wish, and to help citizens. Because we are always saying if the citizens go to another municipality or another municipality, the services, if they are put into place, that citizen that has now moved into another municipality will not feel any type of effect. Hopefully, I have gone under my time allotted to me, and it is very well. I think you took the time to really give detail to this. Let me just recall to the participants. We will put the recording of this webinar in the next few days. Now, if you have to leave, it is understandable. We will take maybe 5 or 10 minutes to field questions, but for those that need to leave at this point for other obligations, please go ahead. Let's go into the question period now. These are two questions could interest many parties here. The first question, it was put into English, and
so it's a question for both of you, Elise and Ketan. Someone is asking, are there designated people whose job is to facilitate the collaboration? If so, what are their job titles and professional background? Ketan, I saw you nodding. Would you like to start?
Yeah, sure. I mean, I think certainly in every case that we studied, there was somebody who was maybe not the leader in name, but who was kind of just adjacent to the leader, doing a lot of the facilitating a lot of collaboration, as the question asks. Job titles were varied. I mean, in one case, the mayor was the leader of the initiative in name, and it was somebody in the mayor's office who was assigned to then help make it work. And you know, what was their professional background? I believe in that case, they were from public health and they had like a good awareness of the interconnections among organizations, and they were kind of seconded into the mayor's office to help them initiate or facilitate this collaboration. Um, I think another way to answer this question is to look up the concept of boundary spanning or boundary spanners. It's an area in sociology which kind of gets right at this point of who, you know, how do you kind of connect the dots amongst partners when you're trying to do a collaboration? And this whole field of boundary spanning, I think, is the answer to that. That's kind of the science of how do you actually bridge across different organizations. But I'm curious, Elise, what you would say in the case of your work.
Oui, parce qu'Élise, finalement, la question est sur quel est le
well,
profil.
the question is, what is the profile of these collaborators to bridge that gap, if you wish, and to create that bridge? Yes, I do understand that very question. If we want someone that to be a leader in the project, but here it's actually the elector, the persons elected that are the leaders in this amongst the two committees I mentioned before. We also have a development agency, but I would say other officers which are important. You spoke about the mayor, but the elected persons from the municipalities preside actually one of the two committees I mentioned before, either the family or the other committee. So when we are making recommendations to the committees, we want to advance these through these persons I just mentioned. I think that actually connects to another question that was asked, and this is a connect. It stems from the inverse situation when there is no openness in the policies. How do you start this? How do you broach this conversation in the context where the equity or health part is not even a priority, or some priorities are not all aligned? Now, from the beginning, was there an opening in the policies or the political side to pursue this type of work? Yes, there was already somebody elected, somebody was doing the job I am doing now. So he was actually splitting his time between two positions, but there was one position dedicated. But to have a partner from the public safety aspect, I would say that's very helpful. With that person, we were successful in working in a type of preventive type of mode also. But it's in terms of all the community organization, other positions are there other than nurses or physicians for prevention also. I mean, it's not only that. So yes, we do have a person. Are you under the impression that have been there for a few years, these initiatives, is there a political willingness to bring that forward the last few years? Do you see that openness? I don't think that there's anything guaranteed on this side of the story. However, that's a good debate to maybe we can talk about. But nothing is guaranteed on this spectrum. But we have to work very hard to conserve what we have in front of us now on this side.
how to start the discussion when the context is not really open to that.
Yeah, so I think it's pretty common that certainly not everyone is going to be aware of inequity or understand it in the same way. And in virtually every case we've ever looked at, it takes time. Literally sometimes 12 to 18 months. Like I can actually say how much time because it kind of ends up being around the same for groups of people to get to know each other, understand local issues, trust each other, and really start to work more effectively together on the issues that you might care about as a public health specialist. And so, you know, I would say if there's not really a baseline understanding or appreciation of the need to work on health equity, there's maybe two things I could suggest from our research. First, you know, you need to have ideally a leader, a central, powerful leader who's going to say to the community, this is important work that we do, and we're going to start to come together and try to tackle this. And it doesn't have to be framed around health equity. It can be framed around whatever there is a communal interest around to make the community better. But if you don't have that one leader saying this is important and we should all start to try to work together on it, it's going to be hard for people to kind of naturally decide to step out of their box and start you know, collaborating. I think the other kind of recommend, and so of course you might say, well, we don't have that leader, so what do we do? I think the other kind of lesson is to start with what you do have in common. What is the common ground? Health equity is a really specific, health-focused objective. Like I showed you, many of our cases were focused on quality of life, for example, or other kind of adjacent issues. And what is it that your community can come together around? What are some local issues that have been identified that everyone recognizes need to be tackled? And if you can start to get folks collaborating on something, you'll find pretty quickly that you are actually addressing the social determinants of health in a collaborative way. And even though we're not calling it health equity, we are actually improving fairness and opportunity, and this should trickle into better health equity.
And maybe, as you mentioned, based on your 5 case studies, early results, even tiny results, help, you know, people get on track and feel more enthusiasm toward the initiative.
Yeah, it's very inspirational to see those successes.
Okay, thank you. Well, we have no more questions. We are happy to see that, well, many people have posted in the chat about their own HiAP experiences, and some have started networking like, hey, we work on the same issue, could I contact you? So this is really neat. We are sorry that we cannot comment further because we don't want to keep you really longer. I have one final slide with a couple of resources I could point people to. Thank you. So, of course, you can, to follow this discussion that has been started, you can check out the 5 HARMONICS policy briefs on the NCCHPP's website. If you're looking for more HiAP resources, you could also check, we have a HiAP project with various resources, and we have a special web page for the recently launched Canadian Network for Health in All Policies. It's a network that aims to mobilize knowledge to support the uptake and implementation of HiAP in Canada, and resources produced throughout the network will be made available to everyone soon. So you will receive a short evaluation form. Please make sure to complete it. And several people have asked, well, the webinar has been recorded in English and in French and will be posted on the NCCHPP's website in the coming days. So it's now time for me to thank everyone. Thank you, participants. You have been patient with us. Thank you, Elise and Ketan, for your insightful presentation. Thanks for all the people in my team who have worked behind the scenes to make this webinar happen. And a big thank you to the interpreters, of course. So take care, everyone. Bye-bye.